welcome to the show. We have a guest for you today, and her name is Danielle. I didn't ask her how to pronounce her last name.
Yeah, well, just have a go.
Bublitz.
There you go.
Bublitz. One of them. Better known as Food Freedom Diabetes on Instagram and on her website, foodfreedomdiabetes.com.
As soon as we started chatting with Danielle, we said we're not good with intros, so she just kicks the episode
Yeah.
off for us. She was absolutely great and a huge wealth of information about diabetes. She's a registered nutritionist and type 1 diabetic herself. She is an anti-diet advocate and helps people to heal their relationships with food whilst managing blood sugars and navigating diagnosis of diabetes. I think I said that slightly weirdly, but I think it kind of works.
I don't think you did. We talk about the difference between type 1 and type 2 diabetes. We also talk about prediabetes. We also talk about blood sugar in general, especially as it relates to the wellness concepts of blood sugar and how that intersects with people's cravings and feelings of wanting to lose weight and be healthy, quote unquote. And then we also touch on Ozempic at the end and the use of GLP-1s. So we hope you enjoy.
Yes.
Oh, we're not good at intros though, Danielle. You should know.
Oh, okay. I was trying to be quiet to not interrupt. I didn't
No,
want to interrupt.
You can take
No.
over.
Okay, okay.
In fact, Danielle, yeah, do you want to do the introduction?
Yeah, you just go ahead.
Okay, okay.
I've already introduced you, so.
Hi, I'm Danielle. I'm a registered dietitian in Southern California. I have been living with type 1 diabetes for over 20 years, and I currently work with an insulin pump company training patients. And I also have my own business working with patients to heal their relationships with food and manage their diabetes.
Thank you, Danielle. And thank you for kicking us off, because just for the benefit of the listener, we were saying to Danielle, we don't always find introductions easy. She's like, oh, I can just start. So I already feel like you're going to be a great guest, Danielle. You're going to just carry us along.
Thank you.
So you're type 1 diabetic, and obviously there's type 2 diabetes. And a lot of people probably do know the difference, but I don't know that everyone necessarily knows completely accurately what the difference is between type 1 and type 2. Type 2 is often the one that people are much more scared about developing because there seems to be a lot more stigma and rhetoric around the causes of it. So first of all, what's the difference between both of them?
Yeah, so with type 1 diabetes, basically what's happening is I'll start off with somebody that doesn't have diabetes. When you're eating food, basically those carbohydrates are breaking down into glucose and your pancreas is releasing insulin. And the purpose of this is to bring that glucose, blood sugar, into the cells for energy. When you have type 1 diabetes, your pancreas no longer produces that insulin. And so that's the biggest issue with, that blood sugar sitting in the bloodstream. So a lot of times with type 1 diabetes, before you get diagnosed, you feel really tired, extremely thirsty, all that. And it's because, again, you're no longer producing insulin. And so the treatment is starting to take insulin injections or being on an insulin pump and getting that insulin into the body. When you have type 2 diabetes, what's happening is your body's still producing some insulin, but it's not being used efficiently. So somebody's eating, again, the same type of meal, but this time, while the pancreas is releasing some insulin, there's still some blood sugar sitting there. So when somebody gets diagnosed with type 2 diabetes, they may need some oral medication. They may end up needing some insulin. And I think the biggest issue that happens when somebody gets diagnosed with type 2 is the shame piece, because oftentimes it's associated with food. It's like, well, what caused it? And a lot of times in the media, especially, it goes right back to you ate too much sugar or your weight. It's very fat phobic, to say the least.
Yes.
Speak to that.
Yeah. Exactly. So it's definitely, especially being in this space now, where I have been primarily focusing on helping people with diabetes. Sometimes I even see it within like the type 1 community where they're like, no, I have type 1, I don't have type 2. And I know a lot of my type 2 patients just feel this immense shame or they don't even want to tell people that they have diabetes. I had a couple clients that hadn't even told their family members. Can you imagine? You're going to these events, holidays, whatever, birthday celebrations, and you're hiding something that is, a medical need because of that shame. So, yeah.
But just on that note, so a couple of years ago, I saw a letter on the side of my dad's, and it was an NHS letter from our National Health Service from the doctors. It was listing his diagnoses, and it said type 2 diabetes.
Mm-hmm.
And he'd never told me. And so I said to him, I said, Dad, I said, you've got type 2 diabetes. He said, no, I haven't. And I said, well, the doctor's letter says you have. And he looks at it and he's like, well, they never told me.
Oh
Now,
my gosh.
here's what I know about my father, who I'm pretty sure does listen to this podcast. I really hope so. Is he is very good at hearing what he expects to hear or wants to hear. So I do think he was told. I genuinely don't think he was keeping it from me, but I think he somehow rewrote the story in his mind. And I've heard this from a couple of people who I've worked with who've been diagnosed with diabetes. And they said, I got this diagnosis and then I almost just forgot about it. Like I pushed it out of my mind. There's this sort of defensive. Have you seen that? Like, with clients?
Yeah, totally, totally. I feel like getting a diagnosis of diabetes, like whether type 1 or type 2, there's almost like stages of grief that happen. And I feel like there can be like this denial phase or, just kind of let's push that to the side. That's just on the list of things I'll deal with when I get to my doctor's office, but this is not impacting my everyday life. I know each person's going to have a different experience, but I do find that some people really don't want to like say it out loud, like I have diabetes. And I know also there is a lot of rhetoric around type 2 being reversed. And so I wonder in my own mind, is there a piece of that too that's like, well, I'm not going to acknowledge I have this because maybe I'll just get rid of it by dieting.
Yeah.
Well, it feels like it goes really hand in hand with the sugar demonization that's going on and that has been going on for some time now, because blood sugar, like just that term, not even diabetes or pre-diabetes, but just like blood sugar is the hot ticket. Like I've had clients come to me who don't have pre-diabetes or diabetes who are wearing blood glucose monitors because that's trending to look at like how is that impacting cravings and overeating and how do I lose weight by keeping my blood sugar stable. So I have to imagine that whole trend and moralization around having stable blood sugars, like it is just such a it's like the wellness thing. So it's got to be further stigmatizing not only diabetes but also, I think actually more often I'm having clients come to me saying, I've been diagnosed with pre-diabetes, which feels like you better watch, like it's up to you. And I wonder what your stance on all of that is. How to clear this, because it's so confusing for people who are like feeling like this is their fault and they're doing it to themselves. And then intuitive eating is actually making that worse because now they're not being so vigilant about things and like personal responsibility and all of that.
Yes. Yes. So I kind of just want to share this part because I do try to share this with my clients that I see with pre-diabetes. I can see that kind of like health anxiety is so high for them. But the term pre-diabetes was coined by the American Diabetes Association. And what's interesting is a lot of the times, just because somebody may fall in that range of pre-diabetes, meaning that, like their hemoglobin A1C is like between a 5.7 and a 6.4. And I'll say, because I know in the UK, it's probably millimoles, which, oh my gosh, I don't remember. But essentially, your blood sugars are a little higher than the normal. You may never go on to get diabetes. But when this like term pre-diabetes was coined, all of a sudden, doctors started the diagnosis. So pre-diabetes is showing up on people's lists. And now people are worried because it's going to be the worst thing in the world if they're diagnosed with diabetes. So they're trying to do everything they can to stop it. But when it comes to why someone gets diabetes, it's not sugar, it's not carbs, it can be related to your genetics. If you have a family history of type 2 diabetes, there is a very strong likelihood you will get it. And it's not to scare anyone. It's just that this is the genetic disposition in the family, and it's okay. That's where we find the treatments that are going to help you. But I do think that term prediabetes has put a lot of people in this spiral where they're trying so hard and they're cutting carbs out and they're dieting. And like you said, Stefanie, they're getting continuous glucose monitors. For what? For fixation. It just becomes an obsession. So I personally think that the term prediabetes really has caused a huge increase in health anxiety in people. And what I try to tell my prediabetes folks is that, hey, you know what? I think we need to make sure that we are focusing on health promoting behaviors, that you're nourishing yourself properly, and that, you continue to see your doctor's office to get those yearly labs. Because again, this isn't diabetes, but it's always good to get those labs checked to see, if it goes in that direction, then we go in that direction and we get the treatment that you need. That's not a failure.
Can I just ask about this A1C? Because I follow a few people on Instagram who talk about it, and I see them talking about that. Are they just talking about blood sugar when they say A1C? Like, what is that in layman's terms? It's just that.
Yeah. So hemoglobin A1C is a 3-month average of where your blood sugars are sitting at. Because basically when they do that lab, it's the blood sugar attached to the cells. So they're just trying to see on average, where's your blood sugar sitting? And interestingly enough, Dr. Dodell, I'm not sure.
Dr. Gregory, yes, I love his account.
So I had him speak for one of my groups like a couple of years ago. And I remember him talking about how they are really trying to move away from A1C to more of a time in range. You'll see this with continuous glucose monitors. So when you're looking at what is the time that this person's blood sugars is staying within a normal range for diabetes, rather than this one lab value that you get done every 6 months. He said they wanted to move towards that direction because it's giving a better snapshot of what's happening day to day versus just, bam, here's what's happening. Every, once a year you get this lab done, which can send a person in a spiral for like the next year. I found that really interesting. And I have seen that working with my current company for insulin pump trainings. I've seen a lot of doctors that are using that. And I think it's more reasonable for the patient on the day-to-day, because having diabetes is like a science experiment. It's like you eat one thing, you take your medicine or your insulin, and you get a response. You could do the same exact thing the next day, and you're going to get a different response. It's maddening. It's just maddening. So we can't expect perfection. We can only do what is within our control. And if that is not working for us, we can adjust and make changes that are going to benefit us specifically.
This is like a tricky thing, because it's like, I want to speak to both sides of this. We spent some time talking about like the health anxiety that can get increased, the over vigilance about like interpreting these numbers and making stories about them, that I think people who have disordered eating or eating disorders or body image issues can be very susceptible to. But then on the flip side, there's also this fear of like, how do I manage true imbalances, if this exists, in my blood sugar without feeling like I'm restricting and compromising, sort of almost like the gentle nutrition principle of like, yes, this is something going on in my body. And there are ways that you can not diet or not, you know what I mean, and still manage this. So I feel like that's an important thing to talk about, like giving people permission to pay attention to it to the degree that we do have control over it and that it is relevant for somebody, and to be able to feel like that's not a restrictive way of living.
Yes. I think that's, thanks for bringing that up, because I do see that, especially in like my folks with disordered eating and in recovery from eating disorders. Everyone's going to need an individualized approach. And a big part of my practice with my patients that come in out of, eating disorder treatment, things like that, is really, hey, like we need to meet you where you're at. And we need to make sure like maybe hopping into looking at CGM numbers is also not going to benefit you right now. So let's focus on that nourishing aspect. Let's continue to focus on eating disorder recovery. And we're going to touch on these diabetes components, but do not make this a pattern that becomes disordered on its own. Because I do think there is just another pathway that happens with a lot of people with diabetes that can be very disordered.
So I work predominantly with binge eating, and many people I work with who do not have diabetes are really frightened about developing it and feel like binge eating would increase their risk of developing it.
Yeah.
What would you say to somebody in that situation? Are there things that people can do to reduce the risk that's then not necessarily going to trigger more binge eating? Or just how do you respond to that fear in people who are still actively binging?
Yeah, I mean, my recommendation, if you're still actively having binge episodes, is to continue working through having those consistent meals. You know, I would still say make sure that you are not going long hours without food. I know that tends to be the mindset of like, well, if I'm not having anything, my blood sugars will be better. But actually, when we're not having enough food, especially like first thing in the morning, that can increase our blood sugars. It can make it harder on our body. We're putting stress on our body. So, continuing that consistent intake of food, not going longer than 3 to 4 hours without food, so that you can, one, prevent binging, but two, you're fueling your body properly. And I know I've shared with some of my binge eating patients too, you know, there is a fear about too much carbs, too much food is going to end up resulting in diabetes, but diabetes is so much more complex than that. The causes of diabetes can really, like I said, family history, but it can also be related to, you know, things like polycystic ovarian syndrome, which increases insulin resistance. A lot of times people, you know, may need steroid treatments for breathing, COPD, things like that. So medication can cause that increase in blood sugars. If you have a surgery, even without diabetes, there can be stress in the body. So it's like we just have to understand that there are just so many factors at play when it comes to blood sugar regulation. And food is not necessarily one of those things, but it's highlighted.
Could you just say a bit more about the role of blood sugar and stress, or the relationship between blood sugar and stress?
Yeah, absolutely. So when our bodies are going into a stress state, so whether it's acute, so maybe like mentally, you're just having this day that's extremely stressful. You know, our bodies are kind of going into that fight or flight mode. You know, the cortisol releases, and that can impact our blood sugars, where it makes our blood sugars go up. Vice, you know, on the other end, more like long-term stress. Maybe if somebody has like a procedure, maybe they're having some type of surgery, that's a lot of stress on the body. And as the body is trying to recover, a lot of times people will find, even somebody that doesn't end up with a diabetes diagnosis, their blood sugars are going to run a little higher. That's normal. So I just try to like normalize that with people, that you are going to have your stressors in life. And then if you have some type of surgery or, you know, procedure, you may have some higher blood sugars for that period of time.
I saw a post once by an influencer. Was her own blood sugars, but she showed two charts, and one was having had a really poor night's sleep and eating some melon in the morning, and then having slept well and eating some melon first thing in the morning. And the difference on the chart, visually anyway, was certainly very compelling, that the blood sugar was going way up higher with poor sleep as well, which sounds like another non-food related factor here, right?
Yep. Yeah, absolutely. The quality of sleep is also really helpful. Sleep is restorative. And when people are getting less than 6 hours of sleep, again, that also can, one, it increases those cortisol levels, but it can also decrease insulin sensitivity, meaning that there's a little more resistance in the body with that blood sugar getting into the cells. So, yeah, again, like, you know, with people asking like, well, what can I do if I'm in this pre-diabetes state? Eat consistently. You know, we can learn how to pair our carbohydrate sources that we like with our proteins, some fats, some fibers where possible. Sleeping is also another one. And I'm guilty of it because at nighttime, I put my son to sleep. He's 18 months old and I'm like, now's my time. And I'm like on TikTok and I'm like scrolling. But even if it's 15 minutes before bed where you are really trying to wind your body down so you can go to sleep and you don't have that to-do list running, so you can get quality sleep.
What do you say to people who might say, and this might be true of people who binge eat, which is a large percentage of the people that we're talking to, like I'm doing all these things that I can. I move a bit. I get the best sleep that I can.
Mhm.
But I have like a food addiction, and basically like I'm addicted to sugar, and then I'm eating all this sugar, and I'm throwing off my blood sugars, and that's making me have more cravings for more sugar. And so essentially, like, how do I not feel like the answer is to eliminate sugar or to moderate sugar, because that just feels like the healthy thing to do, and that's perpetuating this cycle.
Oh man, the food addiction, Overeaters Anonymous. Oh, how we feel about this. Yeah. I feel a lot of like sympathy for people that, struggle with this kind of like I'm addicted to food. I'm addicted to sugar because I understand. But as we know, the more we restrict certain types of foods, certain things that we want, the easier it is for that pendulum swing to end up binging on them or ending up just feeling so deprived. So I really think unpacking those beliefs around food, unpacking those beliefs around diabetes, blood sugars is important. And maybe just like learning from providers like yourself, it's like, why is this food still nourishing and helpful for you? Because I think, again, they're looking to the media. They're looking to Glucose Goddess. I don't know if you've seen her stuff. They're looking to people that are representing an image of wellness, and it's confusing. It's completely confusing. And I just think, again, the best thing they can do is learn how to make peace with sugar, to make peace with carbs. And it's also the hardest because as they're doing it, they're going into it with those thoughts. Oh my gosh, Stefanie told me that I'm going to practice making peace with this, like cookie, but I'm feeling so stressed. What's this doing to my blood sugar? And it's like, I think we have to unpack those beliefs and really work through that fear safely first and move forward with allowing these things to be in your life. I know for myself, with my years of dieting and for patients I've worked with, it definitely is that pendulum swing. If you try to cut out sugar, if you try to restrict the foods that you're eating, it's going to swing the other way. But when you can introduce them, it's going to bring that level of importance down, and it's going to allow you to enjoy it in a way that, you don't feel like, man, I can't wait till next year when I'm allowed to have my birthday cake. It doesn't have that high of importance.
Is
I've
there
heard,
any, oh, sorry, go
no,
ahead.
go on. No.
Well, it's just a follow up to that. Like, is there any truth in blood sugar spikes begetting more blood sugar spikes, causing more cravings? And if there is, how can somebody look at not eliminating sugar, or like how can like have introducing these foods and habituating these foods be done in a way that does serve the body?
Yeah. So I feel like my mind instantly goes to wanting to make sure I clarify between maybe somebody that's in a pre-diabetes state and somebody that currently has diabetes and is managing in that way. In a pre-diabetes state, something I want to mention is every person, even without diabetes, is going to have a rise in blood sugar as they're digesting their food. That is the purpose, to give you energy. So normalizing that, yes, there's going to be a rise in that blood sugar for the purpose of energy. For somebody that is not struggling with their pancreas producing insulin or not enough, your pancreas is going to do its thing to bring that blood sugar down. Now, somebody with diabetes, that's the reason they need to take insulin or their oral medication. So if they are struggling, some things that can be really helpful at meals is pairing those carb sources with a protein, with some fat, some fiber if possible, but also does not have to be. This can also become a food rule, as I've seen in my work. But because when you're pairing with those proteins, fats, fibers, all that, it's going to slow down that carb breakdown, and it's going to be a lot more filling as a meal and enjoyable. There's a lot more satiety in that meal. And I always share with people like salads. It's like if you have a salad and it has no toppings, no dressing, no nothing, is that really going to hold you over? Is that going to be an enjoyable salad? Let's get some avocado. Let's get some cheese. Let's get something in there that makes it satisfying. So that's what I try to encourage people is like, if you're concerned about those spikes at those meals, you can try pairing the carbs, proteins, fats, and fibers. In addition, sometimes what people can do is like if you're going out to eat at a restaurant, maybe you share an appetizer with your friends. One of my favorite restaurants has these like delicious roasted Brussels sprouts that have like bacon and some like croutons. It's like, sure, why don't you just like start off with an appetizer that has some fiber in it? Or you could do a salad before your meal. That's another way. There's no set in stone way to doing something, but it's figuring out what's going to work best for you with these specific tools.
In somebody who's not diabetic or pre-diabetic, like with these blood glucose monitors, the thinking seems to be that, oh, we want to find out what foods give us the biggest spikes in blood sugar and avoid them. And I've heard a few other professionals kind of counteracting this and saying there's no evidence to suggest that a blood sugar spike in somebody who doesn't have an insulin or blood sugar, a metabolic problem, that is causing any harm. Well, I mean, what are your thoughts on that from your experience?
Yeah, I'll see if I can share with you guys afterwards. There actually was research done to kind of look at that. Or is there a long-term, consequence? And there was not shown for somebody that does not currently have diabetes when it comes to those blood sugar rises. And again, like I was mentioning, everybody will have their blood sugar rise when they're eating. It's really that 2 hours after the meal. Where's the direction of that blood sugar going? If your body is not effectively producing that insulin to get that energy into the cells, yeah, that's definitely something we want to look at, because we want to make sure that you feel well and that your body is getting the energy it needs. So I do see this a lot on the internet with people wearing continuous glucose monitors. And I feel like it is just very fixating, because it's another kind of like moralization where it's like, oh, I'm doing so great. My blood sugars haven't gone over X amount of numbers. And it's like, okay, but what is that really doing for you? Because now you're controlling the food that you're eating constantly, maybe feeling stress if you don't get that specific number. It's like, this is not benefiting your long-term health or mental health. So yeah, I'll send you guys later, but there is research showing it's not really much of a benefit to doing this type of thing if you don't have diabetes. I remember when I first started seeing this happen, it was so irritating to me because getting a continuous glucose monitor is very challenging as a person with diabetes. It shouldn't be, but it is. The American Diabetes Association just came out with their standards of care this past year. Just this year. What year are we in? 2024? Yeah, I'm good. I know my dates, obviously. So we're in 2024 now, and they say now that there's a benefit for people with type 2 to get continuous glucose monitors, which is good. But a lot of the way of thinking with insurance, all that, is that they need a good reason to get it. So then you see people on the internet doing it without diabetes. And that feels really frustrating. It's like the access of care is not there. Because what could this monitor really do for somebody with diabetes? A lot. It gives them a lot of support for their management. So yeah, I have a lot of thoughts about this and it irritates me. But for those that don't have diabetes, I honestly would not recommend getting a CGM. But I understand if you have, maybe you're in that pre-diabetes range, your family has diabetes, maybe you have PCOS. I've heard from people that have shared with me like, hey, this is helping me because I'm starting to notice my blood sugar and my A1C is getting higher. And I will never disrespect that decision that you make to do something for yourself. I'm just saying more on the wellness trend. I don't think that's benefiting them.
Okay. And even with diabetes, I can see how it can be helpful. And again, I'd be curious of how often you've seen this, Danielle. the experience where somebody, maybe they've been struggling with disordered eating, and maybe they've been telling themselves, gosh, if I ever got a medical diagnosis about something like diabetes, that would be the wake-up call that I needed. And then they get the diagnosis, and then like the fear or the shame or whatever is the reaction to that actually means they end up binging or feeling more out of control around food than they did even prior to their diagnosis, that it can make their eating worse. How do you think about that in what you've seen with your clients?
Yeah, it's really challenging. I mean, I understand, because it feels like a moral failing. It feels like they failed, like they didn't do enough. And I've heard people tell me, I feel like I didn't do enough and I already have it. So it's kind of just like hands up in the air. It's like I did everything I could do. I did every diet. I lost all this weight and I still got diabetes. And I really just try to extend a lot of compassion that, you know what, like you did what was within your control. And, focusing on weight loss, focusing on restricting food doesn't give that guarantee that somebody's not going to get diabetes. It's not if, like if you're going to get diabetes, it could have just been like when, and that's not a failing. That's more of, this is something that's happened. Now let's learn how to treat it and manage it so you can feel your best and continue on with your life and continue on with your recovery, because you still deserve that recovery and that freedom with food, even with a diabetes diagnosis.
It's interesting. I feel like I'm going to like repeat, but just for clarity's sake. And I also want to make sure I'm getting this correctly, because I'm thinking I'm having a metaphor.
Yes.
It's like when I was an occupational therapist, one of the conditions I worked with was MS, right? Multiple sclerosis. And so for patients who had MS, we had to watch, like, especially in the summertime, the amount of heat exposure that they were getting, and making sure they were in the air conditioned rooms and things like that, because excessive heat would create, like where it would impact their ability to their muscle contraction, and like fatigue would also impact like the difference between if somebody could walk that day or not. And it's almost like with the wellness culture, it's like saying everybody has to monitor their heat, and it's kind of like, somebody who doesn't have that diagnosis doesn't have to watch their heat. They're still going to be able to get up and move and walk. And so it's kind of like there's a really big distinction between having a diagnosis and not having a diagnosis. And that the trend of CGMs and like just even with glucose goddess, like the incessant monitoring of these things to prevent something that isn't a risk. It's not a spectrum. It's not like, I don't have diabetes, and I don't have insulin resistance, and I don't have that doesn't show up in my blood work at all. So for me to be so vigilant about watching my blood sugar and managing cravings and even tackling disordered eating in that way, if that was still going on for me, would be almost like just a way of translating control in a place where that's not actually, there's not a representation of that. Like that's not what's going on in my body. So it's more of a psychological thing at that point than it is about like actually preventing something from happening. Whereas if I did have that diagnosis, that would be something I could look at and take care of myself by doing these things. And it would make sense in that respect. The difference, I guess, we're talking about between diabetes, type 1 or type 2, and potentially prediabetes, potentially, but not always, versus simple like blood sugar spikes and management in the wellness sphere, right? These are different things.
Yes. Yes. I thank you. That's exactly, that distinction is important. It's really murky right now in the wellness space, because kind of like what I've seen. Oh, I have to just share this too. I remember I had a patient, I still see this patient, and they basically email me because they're in the pre-diabetes range, and they email me an ad that was on the subway when they were headed to work. I can't remember the exact numbers, but it said, basically it was saying that you have a higher likelihood of getting pre-diabetes over getting attacked by a shark. And I just didn't understand why that would even exist as an ad. And it was like the American Diabetes Association. It's like, get checked now. This person was like, I mean, if this is on a subway ad, everyone's thinking it. And I don't want to have this. Like, I don't want to have this. I don't want to be that person. It's like, I just feel like even how diabetes associations are talking about it is just making it meddle together, where there's no longer a distinction between pre-diabetes, type 1, type 2. It's like, oh, they're all the same. It's like, but they're not. They're not. And not everyone that has pre-diabetes goes on to get diabetes. And you know what? If they do, that's not their fault. And there's ways to manage it.
Many people know someone or know of someone that had a diabetes diagnosis. They quit carbs, they went super low calorie or something like that, lost a load of weight and reversed it. So they'll be saying, well, it's possible. And if it's possible to reverse it, isn't it irresponsible not to do that? Thoughts?
Mm-hmm. I got some thoughts. Okay. So reversing diabetes, and I say this with love, is not possible. It is possible to go into like a remission state. And what that would mean is you're not on oral medications at the time, and your blood sugar lab work is able to go into a range that is out of this pre-diabetes range. I don't like this narrative though, because again, what's it doing? It's putting all the responsibility on you to stop it. And so what I've had with patients is, man, I cut out carbs. I did everything in my power. I exercised all the time and I was in remission. But then I started binging. And then my blood sugar started rising. And then I got diagnosed with prediabetes. So I feel like, again, it's giving this kind of unrealistic expectation that everyone that's in pre-diabetes range should go to these extreme lengths to be reversed. If you can't be in that remission state without restricting or doing very compulsive exercise, this is not the place your body is supposed to be at. Again, I think, that control that Stefanie brought up earlier, I think that comes into play too. So, yeah. So just to reiterate, reversing diabetes is not possible. The correct term is remission, and you would have to have not been on medication and have at least 3 months of your A1C being out of the pre-diabetes range to have that. And again, not a moral failing if that does not happen.
And just for the listeners, Steph and I have done an episode on cutting foods out from the psychological lens, because we think of it, oh, it's just a behavior thing that we do, but there's a whole psychology that comes around that kind of extreme change to your eating. So that's episode 83. If anyone's listening to this and going, yeah, but I still think maybe I should be cutting foods out, please go and listen to that episode first.
Definitely. I think that is super important for sure. And yeah, and I never want somebody to feel, like when I say these things that I'm trying to like burst a bubble. It's more so I want somebody to feel less shame around what they're trying to maybe in their mind feeling like they have to control. It's like you don't have to do this. You don't have to go through those extreme lengths, nor is it really going to benefit you in the long run, mentally, physically, emotionally.
So I know we're coming to the latter part of this episode, but I have to ask about what you think about Ozempic, because this is, I think, on everybody's minds and is a relevant part of the discussion around people with diabetes.
Yeah.
And without.
Yeah. So Ozempic, GLP-1 has been a very effective diabetes medication for a long time for specific patients. Unfortunately, when this, again, kind of wellness trend where higher doses of Ozempic, Mounjaro, these GLP-1s were being prescribed, it slows down your gastric motility and it can make somebody have decreased appetite. You're doing that high dose, and that is, people were seeing results of weight loss. But as you may have seen in lots of articles, that can be very damaging at high doses. I think it's super scary, honestly, to see these like med spas prescribing this to people without diabetes, because again, it's like you're slowing down that gastric motility and it can have a lot of long-term effects. But for people with diabetes, in a way that is not meant for weight loss, but its intended use, it can benefit them. It can benefit their blood sugar management. So I never want to say right off the bat that I hate Ozempic, because I don't. I think it has its place for specific, patients with diabetes that can benefit from it. But I think in the wellness space, it is not beneficial and can be potentially dangerous.
And am I right in thinking that the higher doses is when it's being used for weight loss? Is it a much lower dose for somebody with diabetes? They wouldn't be having a high dose if it was just for the diabetes. Is that right?
Correct. And usually when endocrinologists are prescribing for patients, they start at very small doses because those side effects can be extreme. They can be really hard. And honestly, some patients that get prescribed these GLP-1s, even at the smallest doses, have such intense side effects that they go back to the office and they no longer will use it. Others may not have that same side effect. And so they do see the benefit with their blood sugars, and the doctor slowly manages that. But what was happening in these like med spas is like kind of like off-label use and jumping to those higher doses, which that's where a lot of those extreme side effects were happening.
You may not, but do you have a prediction about where we're going to end up with these GLP-1s? Do you think it's just that it's here to stay, or do you envisage some kind of, fen situation?
I mean, I feel like even at this point, I feel like the shoe is dropping already. I don't know if that's the right analogy, but it's like I feel like people are starting to see the negative effects of using it specifically for weight loss. I don't think it's going to, I hope it's not, a trend that sticks around for too long, because also it was making it really hard for patients that were using these types of medications to actually access them. Same with CGMs. Do you see a trend? People with diabetes cannot access the care that they need, and the wellness industry profits off of it because weight loss. So I hope it goes the direction of ending, but I feel like right now it's still kind of a little popular.
It's only going to end if there's some kind of explosion, I think. I don't see it fizzling out. I think they've done like a survey and it's something like 53% of Americans actively want to take this medication.
And I will tell you this, what I have noticed, because in my current role, I go into endocrinology offices every day. I am learning that a lot of doctors for patients with type 2 in specific will not want to put them on insulin first. They want to put them on Ozempic first, so that, hey, if they lose weight, then maybe they won't have diabetes. And it's like, what the heck is going on? This is not how it works. So again, I think
why wouldn't that, just saying though, why couldn't that potentially be a positive thing if there's a medication that's actually going to bring their blood sugars down? I'm not a fan of this stuff. For weight loss solely. I appreciate insulin is closer to what the body's producing anyway. So it's a more aggressive or different kind of medication. But if it can make a change to their blood sugars, even in that aspect, or do you think that it's risky?
Nothing can replace insulin when the patient needs it, not even a GLP-1. So what I've seen with following these types of patients is they get prescribed a GLP-1, not for blood sugar regulation, but hey, you're going to lose some weight and this will be good, and maybe you won't need insulin. They do that. Maybe they lose some weight, but they're still having issues with blood sugar. And it's like, why isn't this working? It's like, because your body still needs insulin, and nothing is going to replace that. If your body needs it, that's what your body needs. And I think we wait in the diabetes space. Patients have to wait too long to get put onto insulin when their bodies need it. I think that does have a lot to do with that stigma for type 2. So yeah, I don't know if that answered that.
Yeah,
but
it does. But just to clarify, how is Ozempic or these GLP-1s, how does it help people with diabetes? Because there are people who are on it for diabetes at lower doses. So how is it helping these when it's not primarily pushing the weight loss narrative?
Yeah, so it's helping more with like the insulin resistance factor. So it's more of like I would call it more of like an assistant to what the insulin is doing. It's not insulin, but it's like an assistant. And that's the same, when we're thinking about like the oral medications like metformin, things like that. It's like these are more of like assistants to help with that resistance. But if the person's body is not producing enough insulin and that's what they need, nothing is really going to replace that.
Yeah.
Gotcha.
Well, what you were saying earlier about like the frustration you were experiencing, like with the that approach is like it's still associating weight loss with a personal responsibility of having diabetes. Like if we can just get you to lose
Yes.
weight, you won't have diabetes, which is like that's
Yes.
inaccurate.
That's yeah. And I just feel like unfortunately, and I know you both know this very well with, being in the anti-diet space, is that there is so much fat phobia in the medical system. And I really do think that our work with patients is really being the person that listens and being the person that helps them unpack those beliefs that are forming from every experience they have of walking into an office or listening to their family members talk about, I hope I don't get diabetes from eating this cake, or, it's like all those beliefs they have to unpack from what they've seen in their environment and what the way they've been treated.
Does having type 2 diabetes impact your craving for sugar and carbohydrates?
Yeah. Okay. So I will say when somebody's blood sugars are running a little higher, what happens is because those cells are not getting the energy, they're not getting the blood glucose in effectively, you get feelings of hunger. So a lot of times it feels so counterintuitive. It's like, man, my blood sugars are high and I'm also really hungry. So that was something I talked about with some patients that struggle to kind of feel their internal cues. It's like, well, I definitely feel my cues when I'm hungry. And it's like, well, your body is also like, dude, I need energy. Get me some energy. And in reality, it's like they need that assistant, or they need the insulin. They need that support getting that energy into the cell.
So for someone who might be struggling with that, just saying like I've got type 2 diabetes and I think that my cravings for sweet foods is just through the roof.
Mm.
What would you say to them to help them navigate that?
Yeah. So, with type 2 in specific, I would be curious, what does your day of eating look like? Can we kind of walk through that? How are you feeling about looking at your blood sugars? For some that are more triggered, obviously we want to tread on that lightly, but for those that feel a little more comfortable, like, hey, can we kind of look at your day where your blood sugars are running at? Maybe we can figure out, if you're taking insulin, like, is there a way that we can make sure that we're getting this insulin on time? So as you're eating, it's able to cover that and bring you into a range where, if they're still running high later on, they may still feel hungry and they'll feel tired. They won't feel at their best. So trying to kind of get that bigger picture of what is your day looking like, so we can kind of figure out little ways that we can support you and get your blood sugars and your hunger levels to a place where you feel like you're not fixated, or, feeling like that sensation of like, oh gosh, I'm going to binge, so you can move forward with your day.
Mm-hmm.
So I follow some accounts of registered dietitians who speak for Ozempic or GLP-1s, and not in a diabetes management way, but just kind of like this can help people who have cravings and even people in the non-diet space, by the way. It's almost like it can repair the metabolic process. Like that this GLP-1s can repair the metabolic process. And if that can happen, why not? Sort of like, and is that true? Like, I'm like, I don't know. Like, I don't know how that works. So
Again, maybe hopefully they're doing more research on GLP-1s now that they're just like the hottest item around. Hopefully they're doing more to understand what else it can benefit. From my understanding, for hunger levels, I kind of feel like it makes me think of like an Overeaters Anonymous type of situation. It's like is this really benefiting them in the long term? Because what happens if what if they can't access this GLP-1? They're expensive. Not every insurance covers it. So what happens if they don't have this tool available to them? What then? And then at the same time is what doses are being prescribed for them? Because that can obviously have some pretty severe side effects. So I don't know. It's hard to really answer that. My thought would be that I would not endorse it because I don't have enough information, factual information to be like, oh, well, I can see this long-term study shows that it can do X, Y, and Z. I don't really know that. What I do know is the current experience that patients are having.
Okay.
So,
okay. Yeah. I think we just don't know yet. Yeah. But I'm always, anyway.
Yeah. If it's something that helps in the future, that's great. But I don't know. I'm wary about that.
Well, yeah, they've got so overexcited about it, and it's been able to be pushed through because it's been used for diabetes for so long. Because it's been around, there's assumption about so much safety. We don't have any long-term information on higher doses at all, as far as I'm aware.
Right.
What are we
Yeah.
doing?
So maybe it's being done right now, and that's great because we definitely need to kind of see. But as far as I'm aware, the only research has really been more for patients with diabetes and their blood sugar management.
Oh, okay. Well, just remind us, Danielle, where can people find you and follow you and get in touch with you? And what are you offering to people at this time?
Yeah. So you can find me on Instagram at Food Freedom Diabetes. Currently, my offering is I have a self-paced course that I offer. You can find it on my main website, foodfreedomdiabetes.com, or on my Instagram. So if you are somebody that has diabetes, maybe pre-diabetes, and you are trying to continue that path of healing your relationship with food while managing blood sugars, this is a great course to check out. And other than that, that's pretty much it as far as reaching me at this time, just because of my current role as an insulin pump trainer.
Thank you so much, Danielle, for joining us today. Really, really appreciated it.
Oh, thank you so much for having me. It was great.